Are you worried that you may be dealing with a rectocele? Today we're going to talk about 5 common signs that might mean you have a rectocele. First, let's describe what a rectocele is. A rectocele is a type of pelvic organ prolapse, and specifically it's a type of prolapse where the rectum, so in this picture right here, starts to tip forward into the vaginal canal, kind of bulging into that canal. So that is specifically what a rectocele is, a forward bulging of the rectum into the vaginal canal. Now, when that tissue kind of bulges forward into the vaginal canal, it can create a little pocket there. And that pocket can actually kind of let the poop and that sort of gather into that pocket. And it can make it feel like you're not able to empty your bowels all the way. So if you feel like you are straining to have a bowel movement, or you have a bowel movement and it still feels like something's in there, that may be a sign that you're dealing with a rectocele, because like I said, some of that poop can kind of pocket into that little extra area of the tissue and not feel like it can fully empty all the way out. Another common sign that you may be dealing with a rectocele is pain with a vaginal insertion. So whether that be an insertion of a tampon, a finger, a sex toy, partner's penis, this insertion may be painful, again, because that bulge from the rectum is kind of pushing forward into that vaginal canal. And if we're trying to insert something and it kind of pushes up against that bulge, sometimes that can be uncomfortable and doesn't feel like it wants to move out of the way. And so if that's the case, then you might experience pain when trying to insert something because of that tissue bulging forward from the rectum. With the rectocele, it is not uncommon to feel like there's something in your vagina. Again, that tissue has pushed forward from the rectum, and it can just make the vagina feel full, or you can feel that pressure or heaviness there. And there's not actually anything in there, but it can feel like you're sitting on something, or that there is something present because that tissue is giving that sense of fullness there. If the rectocele is low enough or severe enough, that bulge from the rectum forward into the vaginal canal may come all the way down to the vaginal opening itself, and you may be able to see or feel a bulge in the canal. Sometimes you can feel it when you're sitting down. Sometimes people, again, just notice that heaviness or fullness, or they take a mirror and look down there at the vaginal opening and they see this bulge of tissue in the vagina. The final sign that you might be dealing with a rectocele is that sensation or feeling like when you insert a tampon that it gets pushed back out, or it doesn't want to stay in. For some people, the tampon can actually get pushed out and turned as it gets pushed out, because again, that bulging of the rectum into the vaginal canal ends up pushing on the tampon itself. And as that bulge gets more, it can actually kind of push the tampon to the side and almost get it to kind of flip around. So it may feel like you can't insert the tampon, or once you do insert, that it wants to fall out pretty readily and not stay in place, and it doesn't feel comfortable. If you are experiencing any of these signs of a rectocele, incomplete emptying, pain with insertion, feeling like there's something in the vaginal canal, actually seeing a bulge in the vaginal canal, and a tampon potentially getting pushed out, then you may do well to partner with a pelvic physical therapist to assess what's going on in your individual situation. Because the vast majority of the time, we can make a difference and improve those symptoms and improve the rectocele with proper training on how to use the muscles in and around the pelvic area to help support and manage pressure and work together to help these tissues. So just because you're feeling these symptoms doesn't necessarily mean that you have a serious problem going on, but it does mean that you should go and get it checked out. And a pelvic physical therapist can be your best friend to helping to feel like you can get back to normal without having these symptoms in the future. Thank you for watching our video. We hope you found it informative. We put out weekly content on pelvic health topics because we want people to be able to optimize their pelvic health throughout their lifetime. Make sure you like and subscribe our channel so that you're alerted when our next video becomes available.